There are five most important tests you have to do if you think you have COVID 19 infection or a severe disease. Watch the video for more information. My name is Dr. Ashwin Mugundan. I am from Dr. Mohan's Diabetes Specialty Center, Calicut branch. Today I am going to tell you what are the five most important tests you have to do if you got COVID 19 infection. Number one, as you already know, it's the confirmatory test for COVID 19, it's the RT-PCR test. You should confirm if you have COVID 19 or not by doing the RT-PCR test. Because otherwise also, if you have all the classic symptoms of COVID, assume if you cannot do the test, at least assume yourself to be COVID 19 positive and isolate yourself and quarantine yourself and don't spread the disease to any other members to your family or to the society. But if you can do the test to confirm your disease, that is the best thing to do is the COVID 19 RT-PCR test. Now, second test is not too much talked of, but I want to tell you the importance of it and how you should utilize it. Now, almost every other person have a SpO2 probe, the saturation probe at home. I will tell you how to utilize it to the maximum way and how we can identify the damage early before going to a doctor. What we usually do is we put the pulse oximeter at our fingers and see the saturation, and if it's 99, if it's 94 and above, usually we are happy. But what we don't know is the 6-minute walking test, which by which you can identify the saturation drop very early when showing it at the rest time. What you have to do is, if possible, if you're already healthy, you don't have any COVID-19 infection, you do one thing right away. You check your SpO2 now. You walk for 6 minutes inside your room, not too paced, in a normal pace. Then after 6 minutes walking, you check your SpO2 again. Ideally, it shouldn't fall more than 3%. By this way, you will know your normal resting SpO2 and normal 6-minute walking test SpO2 as a baseline. Until and unless you don't have a cardiovascular disease, you're not too elderly, you don't have a lung disease, your SpO2 usually falls above 95%. And even after 6-minute walking test, it doesn't fall more than 3%. This is what normal is. But if you get COVID-19 symptoms and if you want to watch out for hypoxia, you not only check your SpO2 at baseline level at rest, you walk inside your room for 6 minutes and check your SpO2 again. If it falls more than 3%, imagine your SpO2 was 98% at rest, and after 6-minute walk, your SpO2 becomes 92, which is there is a 6% drop in SpO2. What you have to do, if you don't have any underlying lung conditions or a severe heart disease, please contact your doctor or hospital immediately. I'm not making this to give you a panic or fear. It's just to guide you to consult a doctor as early as possible. And in my advice, if you have severe symptoms, please consult your doctor immediately. Please don't panic, because panic is a major problem these days. The moment people get to know they are COVID-19 positive, the panic sets in because of the fear, because of the very grave news we are watching in the TV. Our breathing automatically becomes shallower and the SpO2 falls by itself for 2% if you have panic attacks or if you fear the disease too much. So don't panic, be brave, do these things and take medical help whenever it's required, and be in touch with a doctor even if it's through telemedicine. Please don't forget this very, very, very important test. You might not have heard of it, but if you're watching this video, please do it right away and share this information with all your relatives and friends too. Now, the third test is the CRP test, the C-reactive protein. This is an acute phase reactant, and in severe COVID-19, usually the level goes too high. Usually it is below 5. If it's above 100, it's an indicator that there is some serious inflammation going inside your body. So that is also an indicator for severe disease. And then serum ferritin is also another acute phase reactant, which will help us to identify if there is a severe inflammatory process going on inside your lungs or inside your body due to your COVID-19. Fifth and one of the most important tests these days is the D-dimer. D-dimer basically picks up if there is any clotting mechanism going inside your body. As we already know, the COVID-19 infection sets in by the end of 5 days or 7 weeks, if it's severe, if it has affected your lungs already, there will be clotting inside your blood vessels inside your lungs, and that's what it make the fall of SpO2 or fall of oxygen saturation happens following this mechanism or the phenomenon. So D-dimer helps you to identify early if there is a severe clotting mechanism going inside your body. So these are all the 5 tests you can do. Before finishing it off, I'll tell you, you can do it at the baseline, but I advise you to do it invariably if from the day 1 of your symptoms, even after 5-6 days, your symptom severity is increasing, you are getting a new symptom. If there is a saturation drop, make sure you do all these tests and get medical help. Please don't treat yourself at home. Even through a phone consultation, you can talk to a doctor, get a proper medical advice. Never ever panic, because if you panic, that will cause more problems to your body. So please stay calm and get medical help as soon as possible. And thank you for watching the video. If you like this video, kindly share, subscribe and comment. Thanks a lot.